Okay, we're going to continue on with our assessment here of the posterior thorax. I'm just going to lift the shirt up again here and kind of rest it here as well. So we're going to start with percussion. The technique that I want to use, I'm going to have 2 fingers here and just like that. And we're going to percuss the 10 different areas, and we're going to listen for resonance. So ready? Ready? All 10 areas are resonant throughout. Now I'm going to auscultate bilaterally the 10 different areas as well. Just breathe every time I tell you now. You just breathe in and out through your mouth. Now. 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 One more time. Okay, lung sounds are clear on auscultation bilaterally. And upper, middle, and lower. So now I'm just going to check for CBA tenderness. I'm going to get you to scoot a little bit forward on the chair, and then it's just going to basically be able to take my fist and go. Okay. I want you to tell me if you feel any tenderness at all. No. 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 Okay, great. So then I'm going to move the chair out of the way here. We'll move this back down. Move this out of the way, and then I'm going to have you set on the bed here with your knees just slightly bent here, and then we're going to inspect the anterior thorax first. Okay. So just gonna feel down in this area. Okay. Just noting the skin is warm. There's no obvious lesions. There's no obvious retractions. Chest rise seems to be symmetrical. There's no increased work of breathing. So we have done the inspection. So now we're just going to auscultate the 8 areas bilaterally here. Just breathe every time I say now. Okay. Now. Go through your mouth there, bilaterally. Now. 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 Okay. Breath sounds are clear and equal bilaterally. So now we're going to move on to the precordium assessment. I'm just feeling here. There is no, again, the skin is clear. There's no lesions. It's warm, seems well perfused. I'm just going to put my hand in here. And I'm just going to feel here for the PMI here and around the apex. It's at around the 5th intercostal space at the midclavicular line. The rhythm and rate seem to be regular, about a 2+ here. I'm just pushing in there. There's no lifts, heaves, or thrills noted. So that seems to be regular here. Now I'm going to listen to the heart sounds, the different valves. We're going to start here with the aortic valve here, and this is going to be the 2nd intercostal space at the midclavicular, at the right sternal border here. So just breathe normal for me. Okay, and then I'm going to listen to the pulmonic valve here, which is the 2nd intercostal space at the left sternal border. Okay, and then I'm going to listen for the herbs sound at the herbs location at the 3rd intercostal space, left sternal border. Okay, and then we're going to move on to the tricuspid valve at the 4th intercostal space at the left sternal border. Okay, and then we're going to go down further and to the mitral valve at the 5th intercostal space at the left sternal border as well. Okay, and then I'm going to listen at the apex here for around 1 minute. We've got a timer here. Okay, so our rates around 75 are S1 and S2 are noted. Did not hear an S3 or S4 or a murmur. Sounds appear regular. I want to make a note that we, at this point, if this is a female patient, we would do the breast exam. We would first start by inspecting. So we would check for shape and size, any irregularities. And then we would assess for dimpling via either hands to the side, hands on the hips, or hands above. And then we would move on to the palpation. And we would palpate, and we would want to use our 3 fingers here, going in a circular motion, feeling for any masses or abnormalities. We'd be looking for any discharge. The patient would be encouraged at home to do a self breast exam in the shower after their period monthly. Again, with the same kind of technique, looking for any masses or any abnormalities, any discharge. So we're going to move on to the abdominal assessment here. Okay. So I'm going to have you just drop your feet just a little to keep this up just somewhat. Go back up a little for me if you can, so we can see here. And then I'm just going to move this. And we're going to look here first. We're going to assess. There is no lesions, no abnormalities. With the abdomen here, I don't see any pulsations or any notable peristalsis. So first, we want to auscultate. So I'm going to first listen, starting with the right, and we want to listen till we hear bowel sounds. Okay. Okay. Bowel sounds are active in all 4 quadrants. I'm going to then listen for the femoral pulses. The aortic, the aorta. There's no bruit noted in the aorta, or no other abnormality. Again, didn't see any pulsations earlier. We're going to listen for the renal bilaterally, renal arteries. Okay. Same with the right. Okay. And I'm just going to feel down here, listen with our stethoscope. Okay. And then we're also going to listen with our stethoscope again here for the femoral artery. Okay. Strong, no bruits heard in any of the areas, the aorta, the renal arteries, or the femoral arteries. And I'm just going to feel for your femoral arteries. So I'll just kind of go down here just a little bit here. Okay. About a 2+ on the left side. About a 2+ on the right side. So now we will move forward towards the percussion. So same technique. And I'm going to be listening for any dullness or tympany. So just relax here. So dullness was noted in all 4 quadrants. We're going to continue on with our palpation here. So I'm going to start with a lighter. So just tell me if you feel any tenderness at all.
No. 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 No.
Okay. So no tenderness with light. I'm going to go further, be checking for any masses with a heavier or with a deeper.
No. 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 No.
Okay. So no masses were felt. Either of those. I'm going to do a couple things. I'm going to check for your rebound tenderness. So just relax there for me and tell me if you feel any now. No tenderness. I'm going to check for a pulsation in the aorta here. I don't feel any pulsation, so hopefully no AAA. And then I'm going to feel for the liver at the right below this the rib cage here. external border. Just breathe for me. Okay, liver is not palpable. Okay, so that concludes this portion. So we're going to go ahead and go to our legs here. Sorry, excuse me, our lower extremities. So I'm going to have you kind of set up on the edge of the bed here. Okay, so our lower extremities, our legs appear, they're warm to touch. They appear, there's no particular skin lesions, no gross deformities. The musculature seems equal bilaterally. I'm just gonna take these socks off here.
Okay.
I don't notice any edema as well around the joints. No turgor, chin turgor is good. I'm going to feel, we've already felt for the femoral pulses. First, I'm going to feel bilaterally popliteal pulse here, which his are good, about a 2 plus. We're going to feel the dorsalis pedis here, and his are also good, about a 2 plus. And then the posterior tibialis, which is about 2 plus as well. Let's see here. And looking at the nails, they're about the let's check our. Yep, we got about less than 3 second capillary refill here on both bilaterally. Wiggle your toes for me. Okay. We've got there's no clubbing on the nails, and there's about 160 degrees curvature of the nail. Okay, one more thing I want to do. I want to check for a hernia. So I'm just going to have you step back here, lay back just like you were before. Sorry about that. And then I want you to relax here.
Okay.
And keep your head back.
Okay.
Okay, so there's no hernia noted. And then beyond that, this is a male patient. We would also consider a self-testicular genitalia exam. We would want the patient to do that on their own about monthly in the shower. And what they're going to do is they're going to palpate the scrotum, noting for any masses or tenderness. They're going to check and make sure that there's not any abnormal discharge from the urethral meatus. And then they're also going to palpate the testicles, the epididymis, and the vas deferens as well to make sure that there's not any masses or abnormalities or tenderness noted. And we'd encourage them to do that once every a month, of course. And that would conclude our assessment.